Good morning, everyone. My name is Dr. Antonio Moya. I'm one of the co-founders of the Council of Young Filipino Americans in Medicine and a neurologist in LA County. I have the pleasure of introducing Dr. Aries Limbaga, who is the Chief Deputy Director Operations of Los Angeles Department of Health Services. Now, LADHS is the second largest municipal health system in the nation, and it has about 23,000 employees with an operating budget of over $9 billion. Dr. Limbaga also is the prior CEO, Chief Executive Officer of Rancho Los Amigos National Rehabilitation Center. So I'm very happy to have him this morning. And I would love to ask you, Dr. Limbaga, um, what was your path to leadership in healthcare?
Sure. Antonio, again, thanks for having me this morning. It's exciting to be able to talk to up and coming physician leaders in the United States. So thanks again for having me. I am not a physician. I'm actually a nurse practitioner by background. Um, I actually started at Rancho Los Amigos as a student nurse many moons ago, and then became a staff nurse and supervising staff nurse. And then when Rancho was going to close, I actually left Rancho at that time because, the writing was on the wall that Rancho was going to close, and me at my level, obviously I couldn't make a difference there at that point. There was a great opportunity in San Francisco. I left to become a nurse manager up there. And I did that for a couple of years. And then I got a call from the CEO at Rancho Los Amigos saying, hey, we're not closing. There was a lawsuit to keep us open. And now we are trying to make ourselves more efficient, more cost effective, so that we can stay part of the county. And so that led me to come back to Rancho. I thought that was really exciting. And at the time, they had me lead their admissions and business development department. Now, mind you, I was a nurse manager, clinical my entire time. And I had
Mhm.
asked them, well, why do you need me to run this department? I have no idea about business. And what they said was that we needed a strong clinical leader that we trusted to oversee this area, right? And you have those relationships with folks, and you have that credibility with the physicians and the nurses. So that's why I want you to lead it. So I came back for that. So I started with the admissions team and business development, and then I took on case management and infection control. Basically, I got all these departments because I never said no. I just kept saying yes to everything. And during that time, we were actually able to turn Rancho around. It actually became the most cost-effective hospital at the time. When you look at cost per patient day, we were one of the lowest with great clinical outcomes. And then I became the chief nursing officer for about 6 years, and then was the CEO for about 6 years as well. And that journey to pivot from like nursing over to becoming the CEO was really a role like I never thought I would take, right? I was a nurse. That was my calling. That was what I was supposed to do. But then you realize your impact and your power with and your influence is less about your role, but really about the relationships that you've built and the colleagues around you. And so then I felt much more comfortable taking on that CEO role. So I did the CEO role for about 6 years. Rancho became one of the top 25 rehabilitation centers in the nation. Recently, they just achieved magnet status for nursing, which is something I started 10 years ago. And so Rancho it's probably one of 6 hospitals that achieve magnet status that are run by municipal health agencies. So that's a pretty big deal considering there's about 1,000 hospitals that have magnet. So I think that's been my leadership journey. And then last year I took on this new role as the Chief Deputy Director Operations. Um, In this role, I oversee nursing practice, our APP practice in the organization, um, as
Hmm.
well as utilization management, pharmacy, lab, our emergency medical system. So those are the areas that I oversee. And the reason I moved into that was again to expand my impact, right? And to expand my role, um, because I felt like I could do more. And so
Hmm.
you can do more and have a bigger impact at the system level than at a facility. So that's my leadership journey and
Yeah.
how I've been able to stay in the county and continue to grow over the last 25 plus years.
That's amazing. Thank you, Aries, for that story. And the fact that you've been with DHS for 25 plus years is really inspiring as well. Um, as you may know, a lot of our pre-med students, young physicians are in the Los Angeles County area. So I wanted to ask you, what excites you about working for the Department of Health Services at Los Angeles County?
Great question. I never thought I'd work for the county. When I told you I started as a student nurse, my plan was to go work at Kaiser, but then I fell in love with the population at Rancho, the diversity of the workforce, the diversity of the patients. And there's such I call it like purpose with impact, right? Like you want to find organizations that align with your purpose and align with your impact. And LA County Health Services really did that for me. 90+% of our population are people of color. Over 60% English is not their primary language. We serve mostly a community with that are Medicaid or Medi-Cal in nature, so lower socioeconomic status. And with that, there's huge complexity and scale, which, to be honest with you, is exciting, right? To navigate that world is not easy. So I think that's one of the things that I think is really great is the challenge of navigating and working in that complexity. Um, the other thing is this mission-driven culture. You can go anywhere else, right? But I think the folks here are really here because they care about the populations that we serve. People are really in it for the mission. They're in it for the right reasons, and I think that also makes it exciting for me is because I'm surrounded by individuals that are really dedicated to the people that we serve. Um, and there's actually a lot of growth and learning opportunities in the county if you seek them out. Um, for me, examples, I started as a student nurse and now I'm the chief deputy for operations, right? Who would have thought a nurse could achieve this? And I think that's the other piece is there's opportunities there, and there's enough complexity and diversity in roles that there are. It's just really up to you what you choose to do, right? And how you make that impact. And then, of course, the community connection that we have, right? For as me as an immigrant and a person of color, it was important for me to support that population, right? To support people of color, and how do I best provide the same level or even better levels of care that you may not quote quote see in a public health system, right? And Rancho, as you know, is world renowned for the work that we do, and to be able to do that in a public health system, I think is really um, um, is a testament to the quality of care that the clinical teams provide.
Yeah, I completely agree. It's also the reason that drew me to DHS and Rancho Los Amigos specifically. I think that it's so important to remember our own roots.
I came to the United States as an immigrant. My folks came as immigrants, and so but I grew up in the US, so elementary, high school, the whole thing. I've been lucky enough to go back to the Philippines every couple of years, because we still have family there. So I get that sense of family and that sense of belonging there. But sometimes I think you may not get that if you don't if you aren't surrounded by the culture. And I think what it also does is it creates recognition and visibility for us, right? From the folks who were here in the early 1900s working in the fields or in the canneries to our nurses, our healthcare workers, educators, and professions today. I think it shows the contributions that we've provided to this country, even though it may have been overlooked. It validates the immigrants' experience and the sacrifices and the resiliency that we have in the United States. Um, I also think it creates cultural pride and connection, right? Um, it gives you an opportunity to share your history. So, if you're first generation or second generation, it's a great opportunity to like learn the current culture, right? Learn what it means to be quote unquote Filipino and Filipino American. Um, and then I think it also creates healing and belonging for folks, right? Because sometimes you may feel displaced when you come to the United States. Like we have, nurses who like they don't know anybody in the United States. They come to the US because they got a petition to become a nurse and they come here and they don't know anybody. And having these connections back to the Philippines and this Filipinos, it creates that belonging, it creates that healing for them. I think it also helps us like reflect on our journey, right? How far we've come as immigrants in the 1900s to really being part of the U.S. fabric and our history, really contributing to the success of the United States. Um, and then finally, I think it also allows us to create legacy for the next generation, right? Understand having young Filipino Americans understand their history, not just immigrants, but also how well we have been woven into the American history itself and what impact we've made in US history. So I think that's really key.
Aries, we as CFAM we were founded in the midst of the pandemic when many of our frontline workers who were at the hardest parts of the pandemic were Filipino American nurses, physicians, therapists. So it's just so good to see that Filipinos are represented all throughout the spectrum of leadership in LA County, and that you're representing us well for LADHS. So, you know, I want to end this interview with kind of your words of wisdom, your pearls for the younger generation. What advice do you give to the younger generation who want to become leaders in nursing and medicine and healthcare?
That's a great question. I think, looking back at my career, um, a lot of titles, right? But it's not about the position, it's not about the title, it's about purpose and impact, right? I think remembering, you know, why you're in it, right? Like remember the purpose, remember your impact. Your why is what will guide you through the toughest days, right? Like through COVID, like why are we here, right? Like I think that's what got us through most of those days, and that was to take care of our patients, right? Um, Stay curious and keep learning. Um, I have two master's degrees and a doctorate from Yale. I did those three things while working full time, right? And so as I learned there was a gap in my knowledge, I went back to school to get that knowledge. So stay curious, keep learning, be both a student and a teacher throughout your career. Just because you have your medical degree does not mean you stop learning, obviously, right? And so continue to pursue other avenues that help support your why, and then value your relationships, right? Success in healthcare is built on trust with patients, your colleagues, and your teams. So um, don't make decisions in a silo, right? Like talk to your teams, talk to your colleagues, talk to your leaders. Um, it, that I think that's really important. And then find a mentor and be a mentor, right? And when I see find a mentor, find someone that is maybe one or two layers above where you are today. And the reason I say that is that it gives you a lens that you don't have access to, right? An opportunity to look at things through a different perspective, which will help you in your own career growth, understand these different complex issues within healthcare. And then obviously lead with integrity and courage. Um, I think that is really key. You're going to make tough decisions in your career, and you really have to make those decisions based on your values, right? Like if you've got your guiding principles on how you want your career to be, that will anchor your decisions, right? And I think that's a really good way to look at it. Um, and then, you know, obviously embrace diversity and inclusion, right? I think that's really key. Different walks of life help you in your educational journey. So, like I said, listen to your colleague, listen to the nursing attendant, right? Listen to the floor nurse, listen to uh, the leadership teams, understand their perspectives and that how that aligns with you. Embrace change, right? Like that's really key, is be open to that change. Um, and then care for yourself, right? Like I always tell folks, like you can't pour from an empty cup. So make sure you find the time to do the self-care, uh to do the things that feed your soul. Find that time, because um work will take that time unless you carve it out. And then I think in closing, I just remember, like, leadership, it, it's not a destination. You don't get to something and say I'm done, but it's a lifelong calling. And so just think of that as the journey, right? And enjoy the journey, have fun doing it, lead with purpose, and with courage and integrity. So I think that's what I would tell to my younger Filipino American um, kababayan.
Oh, thank you so much, Aries. That was great advice, and I know that this video will help a lot of our students and even young doctors, young nurses. I really want to thank you again for spending this morning with me.
Thank you.
All
Thanks for
right.